from provider organizations and dental and dental hygiene programs to give some updates as well. So, you know, hopefully anyone on the call also is welcome to join in and provide an update. But I did want to let everybody know we have a handful of people we're planning to pick on first. And then, of course, you can ask questions at any time. We definitely don't want this to be a presentation style meeting. We want people to feel free to chit chat and ask questions and learn. So with that, I did make a couple of slides just so that I keep my brain organized. It helps me quite a bit. And I apologize, just as Amy did, for those who've joined us on other sessions. Some of this is a repeat, but I will move through the first two slides very quickly. So if anyone's joining us for the first time, our State Oral Health Coalition is one of many all over the country that focuses on convening and connecting oral health stakeholders. So we work directly with individuals and organizations. We also serve as the oral health program sole source contractor in the Department of Health. So we help them implement their federal grants and their programs. So that's takes up a lot of our time, but we also receive a number of other grants and corporate and private donations and function as a complete nonprofit to serve the public in Pennsylvania. Our main goal, of course, is to improve oral health for all Pennsylvanians. So our priorities, as many of you are familiar with, we look at workforce, including not just dentists, hygienists, and other dental staff. We're looking at anybody who's sort of part of that oral health workforce, which could include emergency physicians, pediatricians, community health workers, etc. We do a lot of work around community water fluoridation, which is a big problem in Pennsylvania. And if you want to learn more about that, join us at our community water fluoridation session that's coming up in a couple weeks. Looking at Pennsylvania's most vulnerable populations, that includes, you know, those that would be historically underserved, low-income families, ethnic and racial minorities, those with disabilities, really just sort of trying to make sure that we're promoting health equity in the oral health space as much as possible. And lastly, as a coalition, of course, we do a lot of advocacy around implementing oral health into all policies. So that means talking with all of the state departments, that means looking at organizational policies and trying to make sure we put oral health into those things. So if you want to learn more about any of that work, you can check out our YouTube channel. We've got all of our past meetings recorded on there, so that you can, you know, spend hours if you'd like learning about all the stuff that PCOH has done over the last few years. Okay, so on to the meat of our discussion today. Some of these numbers may be quite familiar to many of you. I'm going to see if I bear with me here, guys, as I try to bring up. I'm going to try. Okay, I'm struggling today. Zoom is giving me difficulties. Anyway, so wanted to mention sort of when we look at numbers and you know, what our state looks like. Some of this might be familiar to you. The Health Resources and Services Administration of the U.S. government does regular reports on health professional shortage areas. So dental health professional shortage areas is one of the focus areas that they use. And at last count, so these are numbers from September of 2019, they found that there were nearly 2 million Pennsylvanians living in a dental health professional shortage area. And in order to actually fix that, in order to fix a dental health professional shortage area, you have to have a better than 5,000 to 1 ratio of population to dentist. So these are all areas that don't meet that criteria. You can see the graphic showing the number of population living in those areas, as well as the shaded map underneath is actually showing the areas that are considered dental health professional shortage areas. And we used to call it the T, so it's the northern tier across the state with the solid line down the middle. And then one of our board members, Lisa Davis, who works and directs the Office of Rural Health, told me that it's actually like a J. And if you look at this map, it's pretty easy to see that wrap. So we like wrap around Pittsburgh and we make a J. So it's the J of underserved. And I think it's pretty telling. So we like to look at this map and sort of see where our needs are. We also, out of 67 counties in the state, have 17 counties that have a county-wide designation, meaning the entire county is a dental health professional shortage area. Now, if you live or work in the areas of Pittsburgh, Harrisburg, Philly, you know, Reading, Allentown, you're not going to see those problems quite as much. But, you know, we're a big state and we've got a lot of people living across a big geographic area. So we always like to remind everyone about that. Now, when we're looking at, and I wanted to bring up, because there were some numbers, let me see here if I can, again, being casual here. You come over here. Okay, now we're going to split our screens all around here and get ourselves straight. Okay, so the last thing I wanted to point out was, for those of you who aren't familiar with as much of the work that HRSA does, they've also just recently published a 2017 to 2030 dental workforce report that basically is looking at the supply and demand that's expected of the dental workforce over the next 13 years, 10 years at this point. So it's a simulation model that basically predicts where we're going to be based on what we would call status quo. If nothing major changes, so that's not COVID, that's if everything goes on as normal, here's where we will be, you know, by 2030. And so, you know, based on things being the same in 2030 as they are in 2017. So there's a link to that report, and we'll send the slides out so you guys can look at that on your own. It's only a 4-page report. It's pretty easy to look through. But the general gist of it is that the supply of general dentists in our country is projected to grow 6% by 2030. Okay, and you know, with a slight increase for national demand for all dentists, including specialists. So we see a 9% increase there. When we look at dental hygienists, we would expect that there's actually going to be a supply increase of 20% by 2030, with a demand increase by 7%. So we know supply and demand is going to go up for all of them, but we do see a supply of hygienists going up at a more rapid rate than the rest. So just a little bit of helpful pre-COVID information. As we go, you know, the other piece of that is now we've of course got to talk a little bit about COVID and the effect that that may or may not have on the workforce. So I'm going to give you guys some numbers here, and as you can see on the slides, these are actually numbers that are based on a American Dental Association Health Policy Institute report, which some of you have probably seen. They've been doing national surveys of dentists across the country, and then they sign dentists up to do sort of ongoing every other week surveys. So they've got about 6,000 dentists participating nationally, and they also break the information down by state. So the numbers you're seeing on the screen right now are for our state. These are Pennsylvania specific numbers. So, you know, we knew as of a couple weeks ago that a quarter of our dentists have closed completely during this crisis, you know, and the most of the rest are seeing emergency only patients. The report out as of April 20th was that, you know, 90% of dentists are operating at less than 5% of their normal volume and collections. So that's a big deal. That has longstanding economic effects and probably provider adequacy, you know, effects as well. One of the questions they asked, which I thought was really interesting on April 6th, was, hey, if this continues, will you still be able to sustain your practice? And what we found was that if those restrictions were in place through June, 16% said no way, closing my doors. And if the restrictions were in place through August, nearly 2 out of 5 said, no, we're done, which is pretty scary. I don't know about you guys, but we've got about 10,000 dentists in the state, and we know we already need 300 to meet the numbers that we're at. So if we lose 16% or 38% of those dentists, we're going to have a pretty big mess on our hands. So now I want to, let's see if I can do this. I actually am trying here. I want to go to one of these pages. Okay, everyone should have seen my screen flip there, I hope. The ADA had issued yesterday the update to the survey, so they've asked some additional questions, and one of the key focus areas right now was on the reopening. So as we start to see dental practices across the country reopening, what are we looking like? So this survey was done the week of May 4th. So this is pretty recent information, and I have the survey results up here just for Pennsylvania. So these are Pennsylvania specific numbers again. Basically, and I'm not gonna, you guys can check out this website, you know, you can look at all these numbers, but you can see the swing in, you know, in terms of offices that are closed completely has slightly decreased, but we're still looking at nearly a quarter of our offices being closed completely. So that's not seeing emergency patients or anything like that. And again, our patient volume has not gone up. You know, we're really still looking at most of the dental practices seeing less than 5% in total volume of collections. And I'll kind of slide this down just so you can see. Something to point out is that we have seen an increase in offices paying staff. So we see that number, you know, changing where we're talking about the lighter two purple colors there are, you know, at least partially paying staff. But that should be, it should be noted that the previous study showed that 50% of dentists applied for the, what is it guys, the PPP loan, payroll protection program. I'm so tired of PPP and PPE. But what we have found out is that, you know, that's probably what is adjusting for this swing in starting to pay staff again, is that a lot of these dentists were awarded the PPP loan. So just some information, this is being updated every 2 weeks. So it's really good stuff to look at if you're concerned about dental workforce in our state. Let me bring back my slides here. Oh, yes. And we'll swing you over here, bring you up, and there we go. Okay. So just some information that, you know, I thought would be helpful for us to sort of, you know, lead the discussion and look and see where we're at on numbers. And then my last real slide, I promise I'm not going to talk too much. I just wanted to touch on a little bit of the work that PCOH is doing on our end around oral health workforce. And this was, of course, really pre-COVID determined, but also now we're sort of looking at how to make changes based on that. You know, how do we shift our work to make sure that we're taking into account the changes that COVID will have. So I mentioned, I think on our session yesterday, we've been watching the community health worker certification. For those who aren't aware or don't know a lot about that position, it's a navigator position that a lot of safety net dental clinics use to sort of connect communities with a dental home. And this year is the first year that it's going to be certified in Pennsylvania by the PA Certification Board. So we are submitting a proposal to include oral health as part of the required curriculum for any CHW program, which I think is extremely important. And so we're hopeful, you know, that if they end up with a 120-hour curriculum, that we would at least get a few hours of oral health information in there, just as a baseline. So the other piece that wanted to talk a little bit about, I mentioned that when we talk oral health workforce, we're not just talking dental people. You know, we've been doing a lot more engagement over the last year or so with the emergency physicians group, with the State Hospital Association, and we continue to be engaged with pediatricians and family physicians. So I'm sure most of you are aware that there have been programs in the last few years to help physicians learn more about fluoride varnish and oral health care. We've got webinars on our website for that. So if you work with any medical providers and you want to share information to get them thinking oral health, please, please, please refer them. You know, and then we're also part of a handful of sort of smaller coalitions across the state. There's a Pennsylvania Provider Advocacy Coalition that we work with that sort of gets everybody at the same table, as well as a group called the Coalition for the Common Health, not Commonwealth, isn't that cute? And that group specifically is focused on sort of a quadruple aim of health in the state. So we're sitting at the table with these meetings, and we're trying to make sure that oral health is included in every conversation. Quite honestly, I really think they're tired of hearing oral health when I come to the meetings, but it is what it is. Of course, we're still always looking at how we can utilize our public health dental hygiene practitioners better. We've got over 800 of them in the state, and my best guess is probably only about half of them are being utilized in a public health capacity. So we've got sort of a provider level there that could be doing more, working in the communities and getting people connected to dental homes. So that's something that we want to continue to work on. And then I mentioned, of course, our providers in underserved areas. Interestingly enough, you know, we know that that's the HIPSA side of things and dental health provider shortage areas. But, you know, we also are looking at those that are practicing in those areas. Are they also accepting medical assistance? Are they also accepting patients with disabilities? You know, it isn't just a numbers game, and that's one of the things that it's really hard to get robust data that reflects that. So again, definitely work that we're planning to continue doing. And then, of course, our dental providers accepting medical assistance. Probably most of you have seen the last workforce report that came out from the state that demonstrates that only 23% of general dentists accept Medicaid. So when we compare that to our medical physicians and our PCPs and OBGYNs, you know, they're pretty much at a rate between 85 and 90% accepting Medicaid. So same population, same 2 million people, with only, you know, 1 dentist to 4 physicians to provide services for them. So for us, that's a really big deal. We also look at the Department of Human Services numbers, and they state that we've got, you know, 3,000 providers registered with Medicaid. But when we put those on a map and we actually look, so many of these are big, you know, practices with 50+ providers registered, but only 2 dentists practicing in a week. And so when we actually break it down to locations, we're only around 1,000 locations across the state to see those 2 million people. So definitely deeper dives needed into the data, and we're still gathering all of that. And some of our programs, I think, you know, if you're not familiar with some of our pipeline programs, that's the other piece of the work we do in workforce. So we're trying to get high school students interested in dental careers, as well as dental students and dental hygiene students interested in public health careers, so that we can try to build up who's serving the underserved in our state. And anyone who's from a rural area, you know, knows that if you're not from a rural area, you're not going to graduate from dental school and go back and practice in a rural area. So we've got to be able to figure out ways to get members of a certain community that would be considered underserved interested in dental careers to then come back to those areas and practice. And that's an economic development problem. So, you know, we're touching on all of these different groups. And so I'm saying all this because if it sparks interest or it brings up ideas in your head, even if you don't share them today, you know, always keep in mind that these are the things we're working on. And we love to hear ideas from other folks and what has worked in your communities. So definitely, you know, we're also, I do want to ask everybody, you know, if anybody has worked with any guidance counselor groups or associations, that's been something that's come up recently that we would love to connect with, and see how we can get guidance counselors talking about dental careers, because I don't think they think of those things. So that's pretty much all my slides. Just, you know, and again, the point of this is we share and we talk. You know, if there are any other sessions that interest you, I think we have space in almost all of them except maybe the post-COVID at this point. So there are still some slots left in our sessions that are after this. We've got 2 next week and 2 the following week, if you're interested. And I'm going to stop talking and stop sharing my screen so that we can all actually look at each other. I think I gave Amy plenty of time to upgrade everybody to panelist. I tried not to talk so much, I promise. But I did want to ask, I know I mentioned there were a handful of people we had sort of asked specifically to share some updates. So I'm going to call on Sherry first because I know she doesn't mind being put on the spot. Sherry's going to give a little oh, you know what? I'm going to take that back because I'm going to call on Joanne first because I know Joanne has to leave. Whew, I remembered. Okay, so Joanne's going to give us an update on the University of Pittsburgh Dental School, and I'll stop talking, Joanne, and turn it over to you.
Okay, well, thanks for having me, and I hope that the information I'm providing is what you were looking for, but if it's not, please don't hesitate to ask questions or let me know if there's more, different information you'd like to know. So, I mean, obviously, the COVID-19 situation has been really had a tremendous impact on our educational programs, and we have not just a predoctoral program, but also a dental hygiene program and several specialty programs also at the school. Currently, there's only been on-site, very, very limited crew of faculty, dentists, and staff who are still providing some limited just emergency care to patients. And there's been a lot of teledentistry also from our faculty that are dentists. Students, because they're not licensed dentists, can't provide teledentistry services. So that, is not happening right now. Fortunately, things are kind of opening up a little bit so that we're anticipating jumping back into some clinical care. There's still a lot of unanswered questions as to, what that means in terms of the students, because when the state says, yeah, you can start offering services again, well, what does that mean in terms of the educational process, and can students still provide some of that care? Also, in terms of our preclinic setting, we're not sure exactly what that's going to mean for things that are done in a laboratory setting or simulation setting, or things that are done peer on peer, like, for example, practicing how to give local anesthesia to your peer student. So the main issues that we've had to contend with is that since mid-March, our students have been missing a lot of their hands-on types of rotation. So that's been a big issue for us. And also a big issue was for our graduating seniors, which we do want to get more dentists out in the community to serve those underserved areas. But we were fortunate that it did happen in mid-March, and a lot of the seniors were almost done with their requirements. And we were also, our CODA, our accrediting body for dental school programs, kind of gave a little bit of what they call temporary flexibility with respect to the graduating seniors for this specific year. Such that we've been able to kind of replace some of the on-site exercises with clinically relevant, like case-based troubleshooting, critical thinking kinds of exercises that are done virtually in lieu of that. We were also fortunate that a lot of our students our seniors had already taken and passed the CDCA exam, so that they are eligible for licensing, because we don't really know exactly what's going to happen in terms of the delays in things opening up for these types of exams. Other issues, I mean, of course, like that might not relate specifically to this crowd, but trying to do like remote exam proctoring has been kind of challenging. And we have a lot of student and faculty who also are having some personal difficulties with the current situation. So it could be mental health related issues or personal issues, such as, for example, childcare. We have some students who have young kids that are not in daycare at the present moment. So they're trying to manage learning, taking their online didactic courses, which everything didactic has been shifted online, and a lot of clinical exercises, we've kind of substituted some online exercises as well. So that's been kind of a challenge that we've had to deal with. One plus is that we figured out a lot of things that we didn't know before. Our faculty really kind of switched over really rapidly to that new remote learning style. So there was a lot of a really sharp learning curve there. One thing too also is that we have a standardized program for our students to help practice their communication skills, and that's mainly for our pre-docs. But we were able to do that online, and was kind of an interesting, it went really, really well for them to have that conversation with the standardized patient. which is an act, if you're not familiar with that, it's an actor who poses as a patient, and they have a certain scenario and they have to kind of navigate through that. But we thought it was an excellent, kind of like exercise in teledentistry also for a future dental workforce. So, so that was kind of a plus there. We've certainly learned how to communicate during a crisis a lot better. So that was a good thing as well. And I think going forward, as I mentioned, I think our steps is to know exactly what's going to happen with our reentry, and what are they going to allow students to do in the setting. And that's both at the state level, but also at the university levels. There's a lot of hoops to jump through, and then protocols to set as to what's the safest way to bring them back, using social distancing and pre-clinics and clinics. Although you're not really socially distanced when you're working on a person, but from other peers, and to try to kind of keep it as safe as possible for everybody. So that's kind of like my little brief summary update. And if anybody has any questions, I'd be happy to try to answer them.
Thank you.
Was that kind of what you were looking for also?
Absolutely, absolutely. Because we're getting tons of questions, what are the dental programs doing? And so, yeah, absolutely. That's great. And Pitt is unique with its dental and dental hygiene program. So, you guys are putting out a ton of workers. So it's really important, I think, to know sort of what's going on there. And I know Sherry tells me that all the dental hygiene program directors have been regularly meeting, so she's going to do her best to give us an update sort of on that state perspective of how everybody's handling this. I didn't put too much on your shoulders, right?
No, and thank you, Joanne, for going first, because some of the things would be similar for the dental hygiene program. So I'm Sherry Myers. I'm the director at Northampton Community College in Bethlehem, Pennsylvania. And since this occurred, we had to reach out from all the directors from the 12 dental hygiene programs in Pennsylvania. And we have been meeting weekly. We meet every Monday evening from around 5 to 6:30 p.m. And we just are there as a support group for each other and talking through about what we're doing in the interim with this interruption of dental education, as well as working on what is that going to look like when we return. So one of the first things that we did was we decided that we were unanimously in support of trying to figure out how best to get them into the workplace. And so we did a letter writing and contact campaign to the governor's staff, as well as the State Board of Dentistry. And what we were requesting was that for this class of 2020 only, that they would consider waiving the requirement for the clinical patient-based test. And we were deferring, our evidence would have been that we were graduating students from within the code of standards, and that all of the schools felt that the competencies that we develop in the schools that meet the code of standards for this one class would hope to suffice. So that it gave us a unique opportunity. We were very grateful to have been heard. We were actually invited to a meeting with the governor's staff, who had a lot of stakeholders in for this discussion. And they were happy to come to us in that meeting, excuse me, and share that they were offering a provisional license to the students. And what that would mean is that they would still meet their code of standards. They would still have to graduate from school. They would have to take the computer simulated exam from ADEX, and they would have to pass the national board. And at that point, then they could get a provisional license that would be in effect until the governor would lift COVID, and we don't know when that would be, lift those restrictions. At that time, when it is safe to then take the CDCA patient-based clinical exam, then they would have to still come back. So they would have this provisional license, be able to get jobs, be able to get out into the workforce, and then when the test would reopen, they can then sit for that test, and then they would be fully licensed. So we're not sure what the timeline on that. So we're grateful for that opportunity. However, the feeling still from the directors was that the patient-based tests that was still what we had hoped would be something that could be waived. We do know that CDCA is working right now on development of a non-patient test. The computer simulated part is considered an OSCE, and the students do take that. But they are looking to develop a type-it-on style test. And so that is right now in testing. And once that rolls out, that may be, the state board did say that that would be an option if it was something that was a valid, reliable, and had the psychometrics developed with that test. So I believe I have all that correct. The problem with that, if I'm addressing that and getting them into the workforce, is they still have to be able to return or be considered competent to graduate. CODA did give the dental hygiene programs as well some flexibility with allowing, we had to write reports due to the interruption of education, what that was going to look like for each program. We had to write reports on if we were going to temporarily allow distance education. And so remote instruction has become our new norm. I can say that with all the programs, all the didactic components have been complete for the students, or they are completing them. Time of graduation is going to be different for each of the schools. Some of them are graduating, able to graduate on time because they met those competencies. Again, we were out around spring break. We came back with an extended spring break and put faculty into training to be able to do that remote instruction. And so the sticky point is they still have to graduate. They have to be able to take their 2 exams on the computer-based, and those testing sites are not available at this point. And so part of the conundrum is, although we can get this provisional license, we have to wait until they are opened up, till they can get to those testing sites, and that's all figured out. And they have to also graduate. So for our example at Northampton and some of the other schools, I have to wait until the governor opens up the school. I have to wait then until it is safe to get back in. We also have to make sure we have all the PPE. So we're trying to gather those things and get in the queues, but you know, we can open up the school only as fast as what we're able to get. My concern is that perhaps, this is just my personal opinion, that schools maybe, like if we weren't purchasing N95s before, that we may even, because we get institutional pricing, my worry is that will we be eligible for these and it taken seriously that we need to have these products, as opposed to an office who can pay the full price. So that's just my personal opinion. It's not something I've talked about with all of the different directors. We also have some latitude, some temporary flexibility with CODA to do some non-traditional types of clinical assessments, and looking at things like an OSCE, objectively structured clinical exam, case-based testing. Are there ways that we can test and assure competency other than a direct patient care? And so we've been creative, but again, all of these things we feel very confident that they are testing their critical thinking abilities and getting them ready for entry into practice. Again, once the schools are reopened, we still have to do the social distancing. And so I believe that what we're quoted at Northampton is around 25 to 30% capacity of classrooms will be allowed back in, which means then for the long term right now, because I have a class of 40, depending on the size, 30 to 40 people, that would mean opening different sections. That might be a problem for the schools and with faculty loads, et cetera. So I know that in the short term for us, we probably will continue with remote instruction for a lot of the didactic things, so that we can spend our time and resources trying to figure out how to get them into a building safely, how to then get patients in, protect students, staff, and patients. We're also looking, most of the schools right now, if say we could get in tomorrow, what would that look like? Could we return and do things through simulation on mannequins, on even on each other as patients, student to student, that would cause no aerosols? So that is the big conundrum. So we are looking for ways to, what can we do in the event we can't get the 95 masks and those types of PPE? Is there anything we can do until that becomes available to us, so that we can do things safely? So we're just brainstorming. Like that would mean, no use of an air water syringe, no use of a rubber cup polisher, no air powder polishing, no ultrasonics. What exactly is going to create that aerosol and splatter, and what can we do and putting our systems in place that's going to protect everyone and allow us to still educate them, so that they can contribute and get out to the workforce as soon as possible. Thank you.
And I know we've got some other educators on the line, but are there any questions at this point in terms of the students that are kind of coming out this year?
Is there any problem with the dentists being licensed that are being graduated early, or are they being graduated early?
Joanne?
That's something more at the state level, but from the perspective of students graduating in our predoctoral program, I think we will probably be able to graduate almost everybody. Actually, we're having a virtual graduation this Saturday, seniors. But in terms of licensing, I'm not sure exactly what is happening with the state boards. They will be eligible to obtain a license once they have a degree, but I don't know if there's some restrictions in terms of what can be done.
I know that's been a problem for the physicians, that they get graduated, but they can't go practice because they don't have a license.
And there were, it's on our COVID-19 page. I was trying to find the exact language, but our BPOA, Bureau of Professional Occupational Affairs, and the State Board of Dentistry did release some information. I know, like Sherry mentioned, for the hygienists, they don't have to take their clinical boards. They can graduate and get a provisional license to begin working. And they did something similar with the dentists as well, but I can't remember the exact language. So they did actually come out with some provisions.
I just was concerned about how fast they're getting those licenses to them, those provisional licenses.
Yeah.
Ellen, could I address that? So,
of course.
One of the big concerns is they have to be graduated first. So we can only do that once they can come back, unless they were ready to be assured as competent. And then CODA has allowed that for us to deem them competent if they were that close. I have a few hygiene students who are that close and I could assure competency, but then the other thing, they have to be a graduate. So our graduation is delayed. The school will have a graduation for the majority of the class of 2020 non-dental, but all the allied health students, because they were in the middle of completing, that goes for nurses, radiography, sonography, they have to complete those clinical assignments, and that's the part we haven't been able to move online. And so once, I'm hoping that my students somehow can get back in, that I can get those the class of 2020 graduated, say in August. If not, then our next time for graduation is December. And so it all is based on when we can get back in safely and have that PPE.
The question that I was concerned about is, for the billing purposes for the dentists, if they don't have their license, they can't be credentialed by the insurance companies and they won't get billed. I see Dana shaking her head.
Yeah, I think, and knowing that we're already, I think we graduate a few hundred dentists every year in the state, with, approximately half of them staying in Pennsylvania to practice. So, that's a big shortage where we're used to having them available by the summertime. And if they're not available until 21, we're definitely going to see the effects of that. So, and when you combine that with some retiring and some quitting practice, yeah, it's definitely going to compound. So I do want to you know, I know we have some representatives from all three, you know, the Dental Assistants Association, Dental Hygienists Association, and Dental Association on the call. So I did want to give them a few minutes to sort of speak up and share any insights on the working workforce, already working workforce at this point. Joan, can I call on you first? Let me get you get yourself unmuted there if you can. There we go.
Oh, good morning. Thank you. As you said, I'm the president of the Pennsylvania Dental Assistant Association. And had you asked me this question, what we're doing a couple months ago, I would have had a different answer. But in light of everything, I think working on retention in regards to the workforce is our main goal right now. What we're trying to do is just be a voice and a advocate for our members. Nationwide, we represent like 350,000 people, dental assistants. So that's our concern. We want them to know that they have a voice and that we're working with all the associations and, you know, the CDC and what have you, writing our own letters. One thing that we did do that we're very excited by is we did put forth an initiative for all dental assistants to have an infection control training. This is something that we think for their own safety and public health safety, that is something that in 2020 and through a pandemic that they really should have. So, you know, we're just, you know, putting that out, and we're, you know, getting great response with that. But that's right now what we're working on. Thank you.
Very good. And I don't know if anybody, I know we don't have an official PDAJ person on, but I know we have unofficial PDAJ folks on. So I don't know if anybody wants to share an update on sort of, you know, any concerns that the Hygiene Association has about the workforce situation. Dana, Sherry, Kate.
Well, I guess I really don't know what to say. I know that Linda Straub-Bruce, president of PDAJ, she's been working 24/7 pretty much on a lot of these issues, and trying to get the information out there to the hygienists and the workforce in general as much as she can. I know Lisa Maisonette's been, you know, busting her butt too, trying to get a lot of the information out as well. But, you know, other than that, and I know that they, especially Linda and the PDA president, has been working on that task force and have been meeting with Dr. Levine and the governor in trying to work out, you know, standards and, you know, what can be done with dental and whether, you know, and when we actually can get back into work. So I know that there's a lot of, you know, whenever Dr. Levine talked on Friday, there is just so much interpretation from the information that she has given. So I really think that there really needs to be more detail as to what they really mean. I mean, I've interpreted it, you know, my way, and then you hear others that, you know, were saying, well, you know, we can still go back to work because as long as we're not producing aerosols, you know, but then it states, you know, no routine dental care. And I know a lot of offices are having issues with getting the proper PPE,
Right.
but many are going back to work anyway, you know, with it, and that's leaving a lot of the staff very nervous.
Yeah, absolutely. And Marissa, I think you unmuted yourself. Do you have any updates from PDA?
Yes. Hi, I'm Marissa Swarney with the Pennsylvania Dental Association. I apologize for not being visible. Technology is a wonderful thing until it doesn't work, and for some reason my camera's not working today. I would say before all of this, we were working on things like trying to increase funding and the number of slots available to dentistry in the state's loan repayment program, and also working through the coalition and on our own a little bit to get funding back into the adult Medicaid program, just as a way to bolster workforce and access to care for the underserved. Now we're just trying to deal with the more immediate needs that have arisen from the pandemic, PPE supply being one of them. Just trying to find the places, the people that offer the legitimate resources of PPE supplies for dentists and the entire dental team. That is a growing problem that we're just trying to access reliable sources of that supply. We're also trying desperately to communicate to the Department of Health and PEMA that dentistry is a priority. It's our understanding that FEMA has listed dentistry as number 4 on its priority list. However, we haven't been able to get that in writing from the federal government. And so we're just, the ADA is working on trying to get that more official document from FEMA that lists dentistry as number 4 on its list. And we're just trying to communicate the needs of the dental community at large for those supplies to our officials at the state level. I have the sense that whatever supplies FEMA is giving to PEMA, that the majority, or if not all, are going to nursing homes and long-term care facilities at this point. That's just what we've been told, what I've heard. So hopefully we can improve that situation going forward. And as you've already touched upon, the concern about workforce, I think a lot of older guys and ladies might just close up shop because of this. We've been hearing from some who just are just going to retire because they, have reached that point. And so I think that's going to be unfortunately impacting us moving forward. And also, as you know, they're not going to be seeing the number of patients that they had been seeing prior to the pandemic. And so they're just working, the diminished capacity at this point. And so we're trying to work through all those issues and communicate to our members, because like you said, there's so much confusion out there. Some of them still think they're operating in the red, yellow, green phase of the governor's plan, not realizing what they're allowed to do. Obviously, there's confusion with the guidance. We're hoping to get some of that cleared up today from the Department of Health and get that information out to dentists. And obviously PDAJ and the dental assistant community are doing the same. So I'll be quiet now, and I appreciate your time. If anyone has any questions, please just let me know. Thank you.
Thank you. Yeah, it's I think we're going to need to, something, and I don't know if this sparks any interest, but I think we're going to need to rely on, ways to get oral health care to people in non-traditional ways. We're just going to have to start thinking outside the box because, 6 months from now, this is not going to be, we're not going to have great access to dental services from what it sounds like. So I'm going to open it up. Is anybody else want to share anything? Pat, I don't know if